Today's episode of Embracing Autism IRL is brought to you in partnership with NeuroCure, the creators of ASD Insight, a groundbreaking new test that can identify autism risk at the cellular level even before behavioral signs appear. Joining us today are two incredible guests. Dr. John J. Gargus, the founding scientist and chief scientific officer at NeuroCure, whose decades of research has helped pioneer a biological approach to understanding autism, and Michelle Majewski, vice president of sales at NeuroCure and a mom to a young autistic son whose personal story fuels her passion for earlier support and diagnosis. Together, we'll explore how this new testing method works, why early detection matters so much, and what this innovation can mean for families navigating the uncertainty of developmental delays. Welcome, Dr. John and Michelle. Can I say Dr. John? Is that okay?
You could say that. I go by Jay more commonly, so you can call me
Jay? Okay,
Yes.
Jay is fine if you're okay with that.
Perfect.
Hi, Michelle.
I'm just fine.
Hi, thanks so much for having us.
Absolutely. Thank you so much for coming onto the show today. To start us off, do you guys mind telling me a little bit more about yourselves and kind of just sharing what brought you into this line of work, both personally and professionally? I guess we could start with Michelle.
Michelle.
Perfect. So my name is Michelle Majewski. I live in Massachusetts. My husband and I have a 5.5-year-old son who was diagnosed with autism when he was 20 months. And we recognize how lucky we were to have such a young diagnosis. It allowed him to do all of the therapies available and then some. It was a full-time job for him really early on, but today he's thriving and fully integrated at a school with all typical children. And most people who meet him today wouldn't even know that he had a diagnosis if we didn't tell them. And so it is my absolute passion to make sure that every family is given the same opportunity. And so when I learned about the science at NeuroCure, I reached out to our CEO, Dave Justice, and asked where I could fit in, because I just think what's happening is incredible and life-changing.
Yeah, I always feel like a mom's passion drives things. What about you, Dr. J?
Yeah, so I'm originally an MD PhD from Yale University Medical Scientist Training Program, where I was in the human genetics and in the biophysics department, sort of both together for my PhD. I then did residency in pediatrics at Yale, and I did a fellowship in genetics at Yale. And it was really the early days of medical genetics. Francis Collins, who's the retiring director of the NIH, and I were fellows together at the same time. After that, I went to Emory in biophysics and in genetics. And then I've been at University of California for over 30 years, where I was most recently the founding director of the University of California Irvine Center for Autism Research and Translation. And that was launched by an entrepreneurial philanthropy gift headed up by Bill Thompson, the CEO of PIMCO at the time. And basically that allowed me to put together 60 faculty at UCI and working on different aspects of autism. And ultimately what came out was a set of patents on what was licensed by NeuroCure to sort of start our diagnostic. That's sort of been my trajectory. I retired from UCI during COVID because we couldn't bring anybody in. And I then started working with Dave Justice, our CEO, on this project. We started out inside of his foundation, but it became clear that it was going to be too expensive to do inside his foundation. So we launched NeuroCure as a company afterwards.
Well, it seems like you guys are kind of like the perfect team because it's like two sides to the same coin. So I wanted to kind of hear, because we've got like the scientific side here, then we have the personal experience side as well. Although, Michelle, you also bring a lot of good experience to this. I wanted to ask you, Michelle, as a parent, what was your journey like in getting your son diagnosed? Because I sense that some of that was a driving factor towards your interest in working on this as well. And what challenges did you face along the way?
Yeah, gosh, it's a really interesting thing to like relive those moments, right? I know as a mom, you can relate to the early days when you first recognize that there's something different about your child. It was hard. It was really hard. The bright side, I guess, of COVID was that we were home a lot more and spent a lot more time with Owen, and so we were able to see some of the earlier signs that maybe two working parents wouldn't otherwise have the opportunity to see. He started in early intervention when he was 11 months old, thanks to his amazing pediatrician that also picked up on some early signs. And our early intervention team suggested, because the wait lists were so incredibly long, that we just get on all of them, because they recognized that there was something more going on. So just like any other parent would do, the first time there was a cancellation, we dropped everything and brought him in, and he got his diagnosis at 20 months. It was a lot. It was emotional. It was sad. It was scary. There was a lot of denial. You almost mourn the child that you thought you would have, because at first, I mean, there were some alarming things. We thought that he was going to be the child that lived with us forever. He had 30 hours a week of interventions to start. We did all of the things and then some. We did some holistic things that some people might think are woo or crazy, but we did them all. And it was amazing, and he's doing amazing, and he is absolutely the reason that I'm at NeuroCure. I do have a little bit of a genetics background. I worked for a genetics laboratory, and certainly talked a lot about autism, but my real true passion is early diagnosis, because I have seen in my own family, when you have an early diagnosis, especially under the age of 3, amazing things can happen. And these kids get the tools that they need to live their best life.
Yeah, absolutely. So I have 2 kids who are 6 and 7, both diagnosed with dual autism ADHD diagnosis. And I have a 14-month-old going on 15 months, I think. Am I a bad parent if I don't know the months? And
No, you've got 3 kids. You're an amazing parent because they're all 3 breathing.
well, yeah, that's true, right? But she's already, kind of having some red flags as well. So she's already going through the early intervention process as well. And I've kind of learned that, like you said, the sooner the better, which is why I was so interested in NeuroCure. And a little bit of the selfish side of me is like very intrigued because I'm going through this again with my youngest. So I wanted to kind of ask you, Dr. Gargus, so many families don't receive an autism diagnosis until their child is 3 or even older. I know this is very prevalent in European nations as well. We do have some listeners there. But, for us, it's always been critical to get that early intervention. And the only way we've been able to really do it is to sneak in these studies that the universities do. That's how I kind of sneak my kids in for early intervention. But, from like a medical perspective, why do you feel like this delay is so problematic for the autism community?
Yeah, and it really is well, I'd say one of the most serious aspects of autism is the delay in diagnosis, and we know that the typical age in the United States is still 5 years of age. A limitation is that the earliest you can do it is at 2 years. Maybe you can stretch it down to 18 months. But that's not the case for most families. There is really a resistance to sort of pull the trigger. No one wants to be the person who makes the diagnosis. We've talked with Autism Speaks and with TACA, a number of the support groups, and they say that the kids most typically will cycle for 2 years from when the parents become concerned, going from physician to physician. Why don't we wait 6 months and see how he does, and then we'll reassess a situation. And that goes on. And I think that's really part of the tragedy. Of course, there hasn't been any kind of a test like the ASD Insight test that really could give an objective, quantifiable risk of autism early enough to intervene. But we think that will be a big breakthrough in allowing families to get a diagnosis or a risk assessment at least early on in the process, and hopefully will get them towards therapy sooner, because that's something that's just very, very clear, is that the earlier you intervene, the more effective the outcome. And I mean, you and your viewers probably have seen the full page ads that Autism Speaks takes out, saying the earlier you diagnose, and that's absolutely our message at NeuroCure, is that we think we have the tools for the first time to allow families to begin intervening and allowing a child to cross developmental milestones at an age-appropriate time, rather than trying to do catch-up development on a child who's been diagnosed at 5 but has lost all that opportunity to cross milestones normally. So it's just, we think we will be a means by which a diagnosis can be achieved, and without somebody being resistant to talking about it. It takes the pressure off the doctor.
Yeah, absolutely. And I know just a little bit of my nerdy side with the whole neuroplasticity thing and kids being so young. The brain tends to be a little more flexible when they're younger, right? So like early intervention tends to be more effective for that reason. I think I'm not botching that, right?
No, that's absolutely right. I mean, the brain, humans are very unusual in that they're not fully wired when they're born. They're actively wiring up their brain very actively in those first 2 years of life. But it goes on well into adolescence, and so we can see functionality change in the brain dramatically. So you're absolutely right. Plasticity is much, much bigger the younger you're intervening.
So then let's talk about ASD Insight. You mentioned that a little bit briefly there. What makes this ASD Insight test different from what traditional behavior assessments do? I think most parents right now, when they're looking into an autism assessment, it is mostly behaviorally based. It seems to be more observational. So how is ASD Insight different from that?
The bottom line is that ours is a cell-based assay. It is a biophysical assay. It's actually measuring the mechanism by which cells talk to one another, and it's an organelle dysfunction. It's a calcium channel signaling problem in an intracellular organelle. A lot of your viewers may be well aware of the mitochondrial encephalomyopathies. The mitochondrial diseases, it's another example of an organelle problem. You make the diagnosis in mitochondrial disease by skin biopsy, telling you about what's going on in the brain, because the organelles are the same. It's exactly the same thing for the signaling that we're looking at. It's a common pathway through which all of the genetic susceptibilities, all of the risk genes funnel through this. It's the final step in getting neurotransmitter across the synapse. It causes the little vesicles to fuse into the membrane and signal. So it's a quantifiable, not subjective, it's an objective test that gives you an answer in a binary sense. Either we see the signal or we don't see the signal, and we're able to do that at again using the fancy statistics involved in test design. It's called a receiver operator curve, but we have the same 85% ability to separate kids who have ADOS diagnosed autism from those who have ADOS neurotypical diagnoses. And that's pretty much the statistics that the ADOS test itself has, about an 85% area under the curve. So we think it's a very useful diagnostic test, telling families about the risk, very much the way that the cancer diagnostic tests tell people about the risks that they would have from that. And we want to very conservatively interpret the test so that we know there's 1/4 of the kids who have ADOS tested autism that we do not pick up. So we try not to have any false positives where we're saying a child's affected that's not, but we know that we capture 75% of the cases with autism, but we don't capture them all. And again, we were part of the Autism Sequencing Consortium, so we had the most access to genomic information of all the major investigators around the world. And we don't understand why the group that we don't pick up on our test is there. We don't know what that variable is. We simply recognize that there's a quarter of the kids that we don't capture with the diagnostic. But it can be done at birth. It can be done very early. I mean, again, because males are more frequently affected than females, the discarded foreskin is perfect for doing our assay. Instead of throwing it in the trash, as is now the case, you simply put it in growth medium and send it to NeuroCure, and we can culture it and give you a diagnostic result.
So that was going to be my next question, because I'm sure, Michelle, you know this. As a parent to autistic kiddos, my biggest fear is bringing them to the doctor, because a lot of autistic kiddos don't do well with medical exams and all things medical, and tend to have lots of medical phobias. So I'm sure our parents want to know, what does the testing process look like for a parent who's interested? How potentially invasive is it? What can they expect from the procedure?
So I can go through that a little bit. I mean, basically, obviously, if it's a family, for instance, that has had a prior child with autism, they may be ready to know right away at the birth of a second child, and at the time of perhaps circumcision of a boy, then there's absolutely really nothing invasive. They simply save the foreskin and send it to the lab to work on. For other kids and adults, it's not only for children. Again, a very big increase in the diagnoses of autism are 20 to 30-year-old females, a big window of new individuals being diagnosed that had been missed in childhood. But going back to what we have to do, it's a skin biopsy, which is it's a 3 millimeter punch. If you've ever tried to draw blood from a little child, it can often be a fishing expedition where you're passing the needle in and out until you hit the vein. That does not happen with a skin biopsy. You go boom, and it's with a thing the size of a pen. You just punch it onto the skin. You anesthetize the skin ahead of time, but then you punch it on the skin and you're done. It's fast. It's one pass, and it doesn't need a suture. It heals by itself. It doesn't leave a scar. So we think it's really, it seems like something so different to parents than a blood sample. That's the problem. But in reality, it's actually easier than drawing blood, particularly in kids, little kids that are squirming where you're trying to hit a vein, and it can be hard.
How long does it typically take to get a result?
So the cells have to be cultured. That's why we need living cells, and we have to grow them in our laboratory. So we have to grow them for about 3 to 4 weeks sometimes. We say that we can get the result back to your physician in 6 weeks time as our turnaround time. But mainly because we have to grow up enough of the cells to be able to carry out the assay on it.
Yeah, absolutely. Michelle, I'm kind of curious from your perspective as a parent of a child who is autistic, what would it have meant for you to have had a test like this available when your son was an infant?
Yeah, it's such a great question that I think about often. I know that, I look back to the time that he was born, and we did the cord blood banking because it was available and offered, and there was talk about how that would impact autism. So I knew it was on my mind, even though we don't have a strong family history or anything. So if the test had been available, I definitely would have done it. Looking back, how would it have changed things? It would have taken away a lot of my stress, a lot of the uncertainty. I would have had the ability to do more research on nutrition, things like that, so early on. Because as you know, by the time they're diagnosed, they don't come with a rule book. You're on Google at midnight when everybody's sleeping. What do I do with my kid that has autism? Because you have no idea, right? I would have met the community sooner, the autism community. Autism moms, I see you out there. You guys are amazing. There is nothing more powerful than an autism mom. Watch out, get out of her way, because she wins. I would have loved to have met those people sooner. from a development standpoint, I got to be honest, I don't know that Owen would look any different today than he does, because he still was so young and is doing so amazing, which is why I want to shout this from the rooftops. This is a must have. Your kids need this before too much time has passed. So I don't know that it would have done anything different to Owen. I think it would have impacted me in a really positive way. But it's really going to impact people that otherwise wouldn't get a diagnosis until 5.
Yeah. How early? Well, I think you said yours was around 20 months is when your child was diagnosed. That's almost exactly how old my kids were when they were diagnosed as well. But I think we're the lucky few. A lot of
Oh,
times I
yeah,
talk to other parents,
very.
most of them isn't until like 3, 4, 5. So how do
Yeah.
you feel that like early detection of autism could potentially change a child's trajectory in life?
I mean, drastically, right? I mean, the reason that Owen was diagnosed so young is because it was alarming. I mean, we brought him for a hearing test because we assumed something had happened to his hearing because he no longer responded to his name. And I'll never forget when he was in that hearing booth and he started looking to where the sounds were coming from. And I just started crying because I thought him being deaf was the better outcome, because I was like, what could possibly be wrong? Now, today, I'm grateful that he has his full hearing, of course. Sometimes it's selective, but the outcome, because he was so young, brain plasticity, everything that Dr. Gargus spoke to before, all of the interventions, the availability of those earlier daytime hours. You're not competing with the kids that are fighting for those after school therapeutic hours. There's tons of research that show the earlier that you intervene, the less severe the intervention needs to be. And then when they get to kindergarten, they can go to school and be a kid and have friendships and meaningful connection. All the hard work, was done to get the tools in their toolbox so they can go.
That's true. I hadn't even considered that part of it, that if you get those therapies kind of out of the way earlier, it doesn't have to interfere as much with like school and all the pullouts and stuff that you end up having to do
Yeah.
later.
Right.
Yeah, that's true. I didn't even think of that. So, for families who might be feeling overwhelmed or unsure about this, what kind of support comes with a test result? Dr. J?
Well, we are very agnostic to what the treatment should be. We think that the major goal is to get the information back to the provider that he can then share with the family and map out a strategy that fits with their approach to the disorder. We know that there's a wide range of approaches. We know there's all kinds of published studies on behavioral interventions, ABA and among others, that actually can have a quantifiable published results showing the impact. Dramatic impacts have been shown changing just by making the diagnosis at age 2 compared to the typical age of diagnosis being 5. Again, there's published studies on that, which are, and it's not a short-term impact. It's a lifelong change in the trajectory. So, changing a child's interactions with peers, their IQ, their learning abilities, all of that is making each next step of development easier and easier for the child. And as Michelle said, I mean, you wind up needing less intensive therapy if you start it early. You're also not fighting for all those hours in the after school hours when the therapists don't have any availability. You might be able to get in and get started. But there's published work showing that down to 6 months, there's meaningful interventions that families can take and that therapists can take to improve a child's long-term outcome. So we think it just completely changes the trajectory, the lifelong trajectory of a child intervening early.
So, are there any misconceptions or concerns you often hear about genetic or biological autism testing? And if so, how do you address those?
Yeah, I do have a lot of concerns, particularly about the increasing use of what's called a polygenic risk score. So again, my center at UCI was part of the Autism Sequencing Consortium, basically the group that handles the vast majority of the data that's been assembled trying to do gene associations and mutation assessments in autism. And what's absolutely clear is that every mutation that's found in a child who is affected with autism is also found in the neurotypical population. It's just much more common in the kids who have autism. So you can't just look at a thing and say, oh, somebody published a paper on this gene, it must be the cause of your child's autism. That is not science. Using those kind of risk scores is really just what I would call junk science. And again, just last week, I presented our test to the Autism Sequencing Consortium, all the international investigators looking at the genes involved in autism. And they pretty much all concurred with that. Nobody thought you can make a diagnosis of autism based on the genetics. And there are what we call major effects syndromic causes. So things like Fragile X, yes, that's a meaningful test. Some of the deletions that are picked up with the microarrays, yes, that's a specific syndrome. Yes, you can do that, but not picking up little signals on hundreds of genes, literally hundreds of genes that might bring a risk. Instead of a one-time risk, it brings a 1.05 risk. And these minuscule added risks, and to add that up and think you're going to make a meaningful diagnosis is silly. It's quackery. So I worry about that a lot, and I worry even more that it would be used prenatally. That's a real problem.
Yeah. And I think when you say prenatally, I'm assuming that you mean that people would take the results. I guess, could you expand upon what you mean by that?
Well, I mean, the genetics that you see in a newborn baby are exactly the genetics you would see in a fetus in utero. It's the same thing. We do all kinds of genetic tests on amniocentesis. Mm-hmm. And it's very meaningful and important for a lot of disorders. But what it's not meaningful for is diagnosing autism, because there are just too many very weak genes that are involved. By weak, I mean they change the risk that a child will have autism by a trivial amount. In aggregate, people try to say, oh, but we've got 300 of those, and let's add them all together and see if the child's at risk. Very, very bad idea. No validity to that at all.
Yeah, that's actually something relatable, because my mom went through an amniocentesis thing and the results were totally inaccurate. So it was good that she did not follow their advice, because it was completely inaccurate. So who do you see, I guess this would be more for you, Michelle, who do you see this test benefiting the most? Would this be more for like first-time parents, maybe families who already have existing concerns, or those who might already have autism in the family? I think you even mentioned adults could potentially do this test.
Yeah, I mean, it's for all ages. I think that when the test becomes available, which will be soon, I think there is going to be a lot of interest. I think first and foremost, where we'll see a high volume of families interested is families that already have a child that has a diagnosis and maybe are pregnant with another. We know that the risk of a second child with a diagnosis is 7 times greater than the general population. And so learning that from birth, again, especially for boys, because the circumcision skin is already available. It's almost a no-brainer. I think that you think about any new mom, right? There's a lot of talk in the media right now about autism. I think the most recent numbers that came out were 1 in 31 children end up with a diagnosis of autism, and even higher for boys. So any pregnant mom it's going to cross their mind. So I can see people being very interested, but also, and I know that you've had recent guests on the show of adults that have a new diagnosis and what it's really done for their life to make them feel whole and complete and give them community. So I think that there's a lot of different groups that are going to be interested in our test. But my gut tells me that first and foremost, it's going to be infant siblings of a family that already has children diagnosed. Dr. Gargus, you might have differing thoughts.
Yeah, no, I think that's the case. And as I said, there's also this window, this sort of surprising window of females who were missed, because there's a lot of talk around the diagnostic criteria for females being different. And I think that will also be a large group, the 20 to 30-year-old group that really have struggled. And I think having a diagnosis might, target them to meaningful interventions and also to take some of the worry out of what's going on. Why are they having these kind of problems?
Yeah, it's funny that you say that, because that was kind of my trajectory in life. I had my 2 kids. They were diagnosed. My parents kept saying how similar I was to them when I was a kid and how none of that was strange because I was the same way. So I went in, got a formal, full evaluation done, and was a late diagnosing myself. I got a diagnosis 3 years ago, thanks to my kids being diagnosed.
Right.
So yeah, I think there's definitely some sort of genetic component, because I have a nephew who's autistic. I've got relatives that are autistic. So I think this will be helpful for families like mine too, that are just kind of investigating a little bit, because you don't find out until after you have kids, and then you have to backpedal.
Right.
So
Yeah.
that would be interesting, I think.
Yes.
So how do parents gain access to NeuroCure's ASD Insight test? What is the first step that they would have to take?
So we are doing everything in our power to educate all providers that work with children. So general pediatricians, developmental pediatricians, whether they specialize in neurodivergence or not, we want all providers to know the science of our test. So we encourage every parent that has questions to talk to your local trusted provider. Ask them about it. If they haven't, learned of us yet, they can certainly reach out to us directly. Our website is neurocure.com. It's NeuroQure.com. Follow us on social media, LinkedIn, talk to your doctor. The autism community is an amazing one. And so it's not going to take long, I think, for everybody to know.
And if there's one thing you want the audience to kind of take away from NeuroCure and this ASD Insight test, what is that one thing that you guys would want them to take away?
Wow.
You want to go first, Michelle?
No pressure. I didn't prepare you for this one.
For me, it's knowledge is power. It's a scary thing to consider that your child might be different. And we say different, but it's not different anymore, right? 1 in 31 is a really big number. It can be scary. It can bring all of the emotions, but the sooner you embrace it, pun intended, and acknowledge it, you get all of the information you need to help your child live their most joyful life. So knowledge is power.
So Michelle,
Yeah, and
go ahead.
No, I completely agree with everything that Michelle is saying. I mean, the opportunity to take really cutting edge science, and again, it really took 3 Nobel Prize winning technologies to make the NeuroCure ASD Insight test, to take advantage of this knowledge that's been built up over 25, 30 years of investigations into this problem, to allow the children to have the best life that they can. And I think that's the thing that you really have to embrace about the autism diagnosis, is that when you come to recognize that you have a diagnosis, you can now take action. You can now do something about it. And that is really demonstrated already to be really essential. So I think that's what we really view as the important thing that we would want the audience to remember, is that making an early diagnosis is really important.
And so you kind of both alluded to this a little bit, but I ask everybody on the show the same question. Our podcast is called Embracing Autism, and whoever wants to take this, feel free. But we just want to know, what does embracing autism, or the concept of embracing autism, mean to you personally?
So for me, it's changed, along our journey. At first, I would have said embracing autism is, opening your eyes and, not putting your head in the sand, and really embracing all of the scary things that are to come, because that's what's going to help your child. Now, my opinion is that embracing autism is that everybody is different and the spectrum is large. I've alluded to the fact that my child's doing amazing. And I often don't tell people that he has a diagnosis, because he doesn't need accommodations most of the time. And so it's no longer really a talking point. And so sometimes when I mention, people look at me and judge, and, just because my child doesn't look any different, or in the 1 hour interaction that you had with him, he seemed very typical. That doesn't mean that our story, right? And it is a large spectrum, and so everybody should really embrace the differences of that large spectrum.
That's really relatable, especially as he grows up. I'm sure you'll notice that he's gonna need some accommodations, probably without people recognizing it, because I know I ran into that. So go ahead.
No, I think it's a great name for your podcast. I mean, because that really is, I'd say that's almost a central point. Michelle alluded to a lot of the fear and so on that go about it, but what you have to do is say that an early test allows you to see, to believe that that's a problem that you need to do something about, that needs to be an action item for you as the individual that's affected, or certainly it is for the whole family. And I think that is the reason to embrace autism, is to embrace that diagnosis, so that you can do it to make the life as meaningful, as useful, as happy as it can be.
That's absolutely true. That's definitely why a lot of parents seek an early diagnosis and early intervention. So where can I...
thing is, even if you are seeking an early diagnosis and an early intervention, I don't know what it's, I don't know, Leah, what state you're in, but in Massachusetts, it's 12 to 18 months.
Oh, yeah. No, so I'm in Georgia, but everywhere I've ever been, it's like 1 to 2 years for these things. That's why I do the studies, and I always tell my listeners, do the studies. You get in a lot faster.
Yeah, but it's we're here yelling from the rooftops. Early intervention is critical, but you can't get an early diagnosis though until.
Yeah. So let's definitely get that information out there to my listeners. Where can they learn more about the test, connect with NeuroCure, or ask y'all any questions if they're interested in the testing?
Yeah, they can go right to NeuroCure.com.
Okay, perfect. For those of you on audio only, NeuroCure.com. It's NeuroQure.com. Thank you so much for joining us on the podcast today. This was really informative, and I really think that our listeners are going to get a lot of information from this. Hopefully, they're going to be able to use this. You guys said it's going to be coming out around September-ish. Is that what you said?
It'll launch in the fall.
In the fall. So it'll be fall for you guys out there listening. That's 2025. Don't know when you're picking up this episode.
Oh, yeah.
So thank you so much, and I appreciate having you all on the show.
Oh, thanks so much for having us. This was fun.
Great conversation. Thank you very much.